mentioned, telehealth, and we know that one of the barriers to receiving care, and you've indicated that in terms of having access to a multidisciplinary team, having access to thoracic surgeons as opposed to general surgeons. So we know that that is impacted by where we live, and that often our geographic location can actually be a barrier to the receipt of quality care. So I'd love for you to just talk a little bit about how patients who may be in more remote locations can make sure that they are also receiving appropriate care for their lung cancer.
Yeah, I think this is a very substantive challenge. I think this is one of the holes in healthcare, is these regions of the country where you just are not going to have access to any number of surgical subspecialists or radiation oncologists or lung cancer specific oncologists. I think that is a really big challenge. I think we have actually learned through the pandemic that this physical barriers really are not the reason to not get the best care. So I think those patients should be exquisitely interested in telehealth and in phone calls. And I think most healthcare systems now, because the reimbursements have been approved for telehealth, have actually now built infrastructure to support it as an ongoing concept. So now if you are a patient that's in Arizona and you want to talk to a doctor who's in New Jersey, you can do that. You can make that happen. If you find someone, you Google them, you find a friend in that area who knows someone, you can call their office and say, I want to have a telehealth visit. And as long as you have broadband internet and a phone, you can do it. You can have that conversation. So I would advocate for people to really make sure that you at least feel like people in the sort of local regional area that you can perhaps get to, maybe 2-3 hours away, but you can imagine a scenario where you could get there. You can try and establish some level of care and some level of rapport with them. I think that's something that has really has been one of the few good things to come out of the pandemic.
Exactly. I was going to say the exact same thing. I mean, that is one, there haven't been a lot of positive things, but that certainly is one of the positive outcomes of the pandemic, is this surge in, it's not that we already had the capability, but it certainly was not being used to its maximum capacity. I appreciate that. So speaking of telemedicine and COVID, I think one of the challenges that patients and often care partners have is understanding when is a telemedicine or telehealth visit appropriate versus when do you actually need to go see that doctor in person. So can you help clarify that?
Yeah. So I think in general, even if you start with a telehealth visit, I think there's very little downside to a telehealth visit for almost anyone in general, because a lot of the information can be garnered from the patient record, from the scans. I think in general, it gives you 85% of what you need out of that interaction. And it may be more convenient for the patient. A lot of times it's actually more convenient for the doctors. Doctors have now found ways to work from home. They do half day of their clinic from home. It's a much more relaxed environment. They're more efficient. I think there are times, like for instance, I have to make decisions about offering surgery to patients who I consider to be moderate or high risk. I think there is benefit in having that patient come and see me in the office, because they have to, to some degree pass what we call the eyeball test. And that is a little bit of where this disparity comes in lung cancer surgery, because it depends on whose eyeball is looking at you, making a determination about what they think is going to happen with you in surgery. I remember one of my favorite patients ever. She had data that did not look like she would tolerate surgery. Everything about her data did not look favorable. And I remember seeing her in person, and you could see the spark in her eye and the energy that she had. And I said, you know what, we're going to do it. And she did great. She did phenomenally well. And that is a case where if you're in that population of patients that may be slightly more moderate, slightly more high risk, and you need someone to really look you in the eye and you say, I'm willing to do what it takes to get through this, I think that's the patient where the in-person visit really is that extra touch that can be beneficial.
Wow. I love what you said about the spark in her eye, and also how you connected that, to health disparities. And I don't know the race or ethnicity of the patient that you're describing, but, we certainly know that makes a difference. And I just wonder, if that had been a different physician, would they have seen that same spark? And I think it just goes back to what we were talking about earlier, and the importance of finding a physician or healthcare provider with whom you connect, someone that actually respects you, someone that listens to you and sees you as a whole person. So the fact that you were willing to go beyond that data on her chart, which, screamed, this is a poor surgical candidate. But then you met her in person and something about her let you know that she was going to be okay.
And that's why it's still medicine, medicine and surgery is still art at the end of the day. It's still an art. You make decisions, best informed decisions, but there's a lot of it that is still really special and mystical in a way. And I think having that in-person interaction is what lets you practice that. And it's all, exactly what you said. You want to have a really nice relationship with a physician, especially anyone that's going to be doing anything that might be invasive or dangerous, because for the most part, you meet someone for 45 minutes and then you sign up for what could be a life-threatening event. So you, the physician and the patient, should feel really good about that interaction. And whatever that energy is, it's really important. It's a little bit kind of sacred, I think. And I think it's really valuable to invest in that. If you don't like the surgeon and you really don't feel like it's a good fit, or you don't like your oncologist, find someone else. You'll do better in the long run, for sure.
That is so incredibly important. I agree 100%. So much of healing is beyond just the nuts and bolts, right, of the medical care that we provide, or in your case, the surgical care. There's so much more to that that's not really well studied, but that relationship and that connection is key.
Critical. And that's not to say that necessarily the person has to be like the warmest, friendliest, most fun person you ever met. Some people prefer a more yes ma'am, no ma'am, clear cut, well-defined boundaries relationship. Some people prefer a big hug and a laugh and a joke. So if you're getting what you need, that's exactly what you need. And if you're not getting what you need, you should think about your other